Hello and welcome to the Could This Happen in Your Program podcast, where we find collaborative solutions for protecting New Yorkers in care. In this episode, we dive into a complex and often misunderstood behavioral eating disorder, pica. Characterized by the persistent craving and ingestion of non-food substances such as soil, chalk, fabric, or metal, pica presents unique clinical and safety challenges, especially within the intellectual and developmental disabilities community. Our guest today is Dr. Mary O'Neill, Principal Psychologist with the Bureau of Clinical Project Management at the Office for People with Developmental Disabilities. Today, we define pica, discuss what it means for ensuring safety in care settings, and how providers can build environments that prioritize both dignity and life-saving supervision. Okay, well, Mary, thank you so much for being with us here today. We appreciate you joining. To start off, could you just introduce yourself and your role with OPWDD?
Yes, thank you for having me. My name is Mary O'Neill, and I am a psychologist by trade and training. Currently, my role with OPWDD is the director of our Bureau of Clinical Project Management under statewide services. But I have been in other positions in OPWDD, and prior to coming to OPWDD, I also worked in other state systems that are similar as well.
Excellent. And for our listeners, we're here today to talk about the topic of pica, which some may not be familiar with. So could you define that for us? What is pica or pica-related behaviors?
Of course. And thank you for making that distinction. I also like to talk about pica-like behaviors instead of just pica, because pica in itself is a diagnosis. And there are a lot of people who engage in similar behavior. They may not have that diagnosis yet, but they still have equally concerning behaviors that need support. So I do think it's important to think of it as pica-like behaviors. But pica behavior in general is when people are, as a pattern or routine, eating non-edible or non-nutritive items or items that are not meant to be eaten. So sometimes that can include raw food items, which technically is still a food,
Right.
but it's consumed in a manner where it's not cooked or it's not prepared in a way that it's safe to eat.
And, in your experience, people with disabilities may have a higher likelihood to engage in pica behaviors. What are some of the most common drivers for pica? Is it a sensory need? Is it a nutritional deficiency that they're seeking? Is it more psychological? Can you talk a little bit about that?
Sure. So you're correct. There is not one reason why pica emerges in different people's lives. People with developmental disabilities, specifically autism, and also specifically severe and profound intellectual disability, are higher risk. There's also correlation with ADHD. So there's all sorts of reasons why somebody might develop pica depending on their specific presentation and needs. Foremost, we always want to rule out a medical reason. So there are physical health deficits and deficiencies that can be leading people to engage in that. So I think the most notable is when we look at people that are pregnant, they tend to have higher rates of pica. So clearly there's a biological element
Like an
there.
iron deficiency or
Yep,
something? Maybe?
and zinc. And so when somebody is suspected of engaging in pica behavior, usually it's a medical doctor who's looking to rule out an iron deficiency or zinc deficiency or other medical reason for that. So once that's ruled out, there are other reasons why people might engage. So some is like automatic sensory feedback, could be oral stimulation and sensory. Sometimes it's a learned behavior. There are also times when it's self-soothing. So there are many reasons. There are also reasons that are not as directly related to developmental disabilities, such as people that are intentionally engaging in self-injurious behavior.
Understood. And so, at the Justice Center, of course, we are tasked with investigating incidents that may occur in programs licensed or overseen by OPWDD, and they may involve pica behaviors. And so we took a deep dive in preparation for this interview into some of the incidents that we see commonly come through. And while the overall number of instances wasn't relatively high, what we did see was that the severity of the outcome associated with those allegations or those incidents was much greater. So, it could lead to something like an intestinal obstruction, which maybe requires surgery or even death and fatalities in some cases. So to us, that means the price of preventing these behaviors inappropriately, or managing them appropriately, I should say, is very, very high. And we want to make sure that we are putting that message out there. What are some potential risks that you could note other than those, or things that you would pay attention to with relation to pica?
Well, you just covered a lot.
So, maybe I stole your answer there.
So first, I do want to highlight and just tell you how much I appreciate you mentioning the risk and severity, because I think that some people don't always understand that even one instance of pica can be fatal.
Yeah.
And so it can be very serious.
Mhm.
And so, yes, there are all sorts of medical consequences of
Mhm.
pica that might be observed, and there's signs and symptoms that can be reflective of pica. But one thing that often gets overlooked are injuries to the mouth.
Mm.
So teeth,
Okay.
damage to teeth, things lodged between teeth, cuts in the mouth. Also, as you said, it can lead to choking. It can lead to obstructions within the digestive tract, which can lead to tearing, and also can collect items and
Mm.
lead to obstructions that can cause all sorts of stomach pain, constipation, diarrhea, vomiting, and uh, then potentially that leads to consequences related to medical procedures such as
Right.
surgery and x-rays, having to monitor bowel movements to
Right.
see if items are passed. So it also can lead to poisoning. People
Mm.
can eat
Yeah.
things that are poisonous to them in certain quantities, or depending on what they're consuming.
And I mean, given all of that and the gravity of the circumstances and consequences, I'd imagine this is it's a challenging behavior to manage for a direct care professional, a family member, whoever may be in that role. What would you recommend to ensure safety without being overly restrictive? I mean, we have to still also understand that people need some freedom and to be able to eat comfortably on their own, independently as best they can. What would you recommend, or what are some of the tips and tricks you would recommend to maintain that safe environment while also fostering independence?
So again, you just have so much packed into that. First, I'd just like to say that pica falls within so many of the under categories. It's
Hmm.
under identified, it's under treated, it's under uh, supported.
Hmm.
And so I think that there's a lot of work to be done to more fully understand it, not just as a general concern and a general diagnosis, but also on an individual level. But yes, whenever we're addressing any type of safety concern, we always want to look at the least restrictive and the least intrusive um, supports that will safely maintain
Hmm.
that person's health. So, yes, I think that it's an under identified and under supported problem, but at the same time, we can swing too far the other way. That
Yeah.
when somebody has this diagnosis, people will become very afraid, especially if
Right.
there is a life threatening
Hmm.
instance, such as choking or needing some type of a surgery to remove obstruction. Like those are very serious,
Hmm.
and they can be very scary. And so then some people might want to swing to being overly protective.
Hmm.
So really, the first line of defense is identification and
Hmm.
understanding specifically what that person is seeking, what their patterns of behavior are related to different objects, and then moving on with environmental modifications
Hmm.
and external supports that are allowing the person free access to their
Right.
community, to their home, to visiting with friends and
Yeah.
family in their homes, while maintaining safety. So um, I don't know if that answers your
No, it does.
question fully.
Absolutely. I mean, do pica behaviors change? So, like, if I have a tendency to be, attracted to swallowing coins or something to that, could it change to another item? I'm
Yes, they
just,
can. And that's why it's really important to understand each person's needs. And once something is identified as a concern, whether you're observing somebody picking up garbage, whether you're observing somebody, having unexplained cuts in their mouth,
Mhm.
anytime you suspect that pica-like behavior is occurring, once it's reported to like the clinical team or the
Mhm.
medical doctor, whoever's supporting that person, whether they're in a certified residence or in a community
Right.
family home, somebody has to do an assessment. So a
Yes.
qualified clinician has to do an assessment to determine what specifically needs to happen for that person. And a lot of that is going to be um, including questions that you just asked. So, like, what type of items are they targeting? When are they targeting them? How are
Mhm.
they obtaining them? Some people are very opportunistic. If they see something, they might impulsively just grab it. Other
Mhm.
people, it's more of a compulsion. It builds within them. They think about it. They want to ingest something. They're seeking it out. So it's very
Mhm.
different how people present. But to that effect, it does evolve and it does change. When people seem to be stressed, that might impact their desire to seek out more
Mhm.
pica-like behavior. And also, like we talked about, there could be compounding things with medical diagnoses
Mhm.
that also could increase their risk. So once somebody has pica, unless it's a medical reason or a physical health reason that's really driving it, it typically is very persistent
Yeah.
and it will evolve with the person over time.
Yeah.
Sometimes that evolution comes from, okay, I generally tend to lean towards, as you just mentioned, items that taste like metal,
Sure.
coins, tacks, paper clips.
Mhm.
But that was removed from my environment. It's no
Right.
longer an option. But my need is still there. So
Mhm.
then I might evolve into something else that's similar and
Mhm.
available. So that's why it's important when we start thinking about environmental modifications and clean environments of what else is edible
Yeah.
and what else is easily accessible in this environment, because though the person may not have um, been attracted to or had shown interest in that item in the past, they
Mhm.
very well may show it as they evolve because they're denied access to certain things that they want. Some people know that pica is not safe and they shouldn't do it, and they still feel the compulsion to do it. And
Yeah.
others, they don't know the difference between something that's safe to consume and something that's not. And others know that they shouldn't, but they just still are going to do it anyway.
Mhm.
So it's very individualized in how people present and what strategies you want to use to support them.
And is there a prevention method where perhaps you have something like a psychologist who intervenes to maybe hear or anticipate some of those changed behaviors over time? If you know someone is confirmed having pica-like behaviors or tendencies, and they, to your point, are connected to metal currently, or metallic objects, but perhaps maybe because they're consistently having a nice rapport with a psychologist on staff or another clinician, they're seeing some some changes in the patterns. Is that something that's recommended? Are they automatically put on a track or recommended for some psychological intervention, or how does that
I
work?
mean, that could be part of the overall treatment plan.
Yeah.
Some people are just going to need some simple modifications in their environment.
Okay.
Other people may require some type of talk therapy or more
Mm.
traditional
Hmm.
psychoanalytic therapy. Some people have behavior support plans where there
Sure.
might be interventions that direct support staff could be using. So if for instance, the person, we know that when they have higher levels of stress and they become more
Yep.
agitated, they're more likely to seek out items to swallow. Then we would have that in a behavior support plan
Yeah.
so that people recognizing that increased anxiety or increased irritability know we better be on the lookout, and what can we do to help ease that anxiety and ease that irritability so that it doesn't get to the point where it's leading to that acting out
Yeah.
behavior.
My last question before we take a quick break, but if there's one thing you want to leave people with who support those with pica behaviors, what would it be?
I think it really is the just underlying safety and concern. It can be a real struggle to get people supporting someone to appreciate the risk.
Mm.
It can be in a school system, it could be
Yeah.
in a residential setting. But whenever you have a group of people supporting someone, it seems like there's always some challenge to get everybody on board with recognizing that this is not just a diagnosis or something listed at the bottom that sometimes we'll talk about. It should be up the forefront because
Yeah.
of the risk that it poses for people. So I think it's just really getting people on board with appreciating how serious it can be. It's a challenge, but it needs to happen.
Excellent. Well, we are going to take a short break. We're going to read a narrative for the audience, and then we're going to come back to some Q&A with you just to see what you might suggest for this specific scenario. And yeah, we look forward to it.
Okay, thank you.
Bob is a person who has pica. Bob requires range of scan supervision and pica sweeps to be completed on each shift to ensure no small items or cleaning supplies are present due to their behavior of trying to ingest inedible items. Linda, a staff member, was assigned to complete the pica sweeps prior to Bob returning to the residence from their day program and was assigned to Bob's supervision once they arrived at the residence. Linda was busy decorating the residence for the upcoming holiday and did not complete the pica sweep before Bob returned home. That evening, while watching television together in the living room, Bob was seated in a recliner and Linda was across the room on the couch. Bob grabbed a tack that held up one of the decorations and ingested it. Linda was watching the television and did not immediately notice Bob had eaten the tack. Once Linda noticed the decoration had fallen and Bob had ingested the tack, they removed the remaining tacks and decorations and called the residential manager. The manager instructed staff to report the incident to the on-call nurse, but it was after hours. Linda called the residential nurse's cell phone and left a message. However, the nurse did not listen to the message until the following workday. The nurse then instructed the staff to bring the person to the hospital for evaluation. Okay, well, welcome back. We have this case history here that we're hoping you can kind of share your expertise in identifying for us, where some of the positives and negatives occurred within this specific scenario. And so, it looks like we've got a situation here where Bob, a service recipient, ingested a tack. And there were some back and forths between the nursing staff and how to handle it. What would you say let's start with the positives. What would you say went well in this scenario?
Well, I think the first thing that we need to consider is just basic training on what pica is and how to identify it. So it sounds like from this scenario, all the staff were aware of what pica is and what potentially could be an item that's danger to be swallowed. And there was some type of guidance in their policy to do pica sweeps. So prior to him returning home, it was some directive somewhere to make sure that the home was swept and clean of dangerous items. So that's a good thing to see, and it's important to have those in place.
And, I think it's great to have the clear supervision plan in place. It's great to have those sweeps in place as part of a policy associated with somebody who has pica behaviors. But I think, of course, then it lends the question, should tax be in a room with an individual who is known to consume those types of materials? So, I think that would be maybe one of the more obvious failures within this specific scenario. Is there anything else you would note within this scenario that you think could have been done a little better?
Well, I think to your point, yes, tacks probably are not a good item to have in the home because they're small and they're easily consumed and they can be consumed very quickly.
Mm.
Um, we don't know this particular person's history of pica.
Right.
Maybe he had preferences in items that were like soft, like lint or foam,
Yeah.
erasers, things
Mhm.
like that. And so it had not been something on their radar to look out for. But I think that goes back to what we talked about earlier with just some basic training on what pica is and how it can evolve.
Mm.
And so if we're removing one item, then they might move on to another item. So
Mhm.
tacks in general, yeah, they're small, they're pointy, can easily be consumed very quickly. Probably for people that have a persistent history of pica, not a good thing to have in that environment, even if that has not been a preferred item in the past.
Right. And I think in terms of the supervision, watching the television versus the person in care, that can sometimes lend to some disruption in that supervision. And then I think we also were just chatting about just behind the scenes, just kind of the notification process. It seemed like there was a lot of people that needed to be notified and questioned before the decision was ultimately made to bring the person receiving services to the hospital, where we probably could have gotten to that realization a little faster just by the nature of what we assumed was consumed.
Yeah, I think my concern and the delay in people identifying this as serious
Yeah.
is the item itself that was consumed. I mean, it is got a pointy end that can be very damaging to both the mouth, like the esophagus, the stomach. I mean, just the whole entire
Right.
system can be damaged by that. And so that in itself should have elevated this to a
Correct.
higher level of concern. Um, but I do think too, like if staff have questions about what to do, because for whatever reason, they don't feel like their guidance is clear,
Right.
there should be identified chain of command for them to ask questions of and
Sure.
help get that guidance. So if the nurse that they had reached out was not immediately giving them guidance, then I would have elevated that very quickly to get guidance from somebody. Because at
Sure.
this point, staff don't know, are we watching and waiting?
Right.
Should we be feeding other foods to help with the digestion of
Yeah.
this? Like,
Yep.
what do we do?
Yeah.
They really had no guidance,
Yeah.
and that's just not acceptable.
Right. Well, I really appreciate your time and talking about this important topic. And like I said at the beginning, it's niche, but it's so important because understanding these behaviors really lend to a more preventative system overall. And, we certainly appreciate your expertise in coming on and chatting with us today. So, are there any other pieces you'd like to leave us with?
Well, I know we've already mentioned this several times, just how serious this can
Yeah.
be, and it is an underreported and
Sure.
underidentified concern. And so I think, even though we're talking about it being niche, I think that really it probably occurs way more often than we realize.
Sure.
Even things like consuming raw potatoes,
Yeah.
consuming ice, if it's persistent and it's occurring frequently within a short period of time, that can be considered pica-like behavior and has other consequences. So um, I just start with basic training and then get the training to be more specific to the people that you're supporting. The policies that we briefly touched on are
Yeah.
really important, not only with reporting and the safety plan for keeping the environment clean,
Yeah.
for sweeps, but also just having very clear expectations of staff and the support team. And how to document incidents, who to communicate those to, and how to pass the information along to the next person. So assessments have to occur. It can't just be a diagnosis on a list, and it can't just be, yes, they have this diagnosis, so we're just going to generally keep an eye on the
Sure.
person. There has to be a very individualized, specific plan for safety for each person. And I'm happy to continue talking about this topic at any time. OPWDD does offer a recorded training, which is much more in depth
Yeah.
than what I just offered. So people can access that through our DQI department. But very important topic, and I appreciate the opportunity to come here and talk with you about it and hopefully raise awareness.
Great. Well, we'll absolutely, for those listening and watching, we will link up that training for you. The Justice Center also offers our Spotlight on Prevention toolkit that has a bunch of different PICA-related scenarios, similar to the one we covered today. You can practice and train with your staff to identify such behaviors and hopefully prevent incidents from occurring before they start. So really appreciate your time. And yeah, I hope we can talk about it again because it is such a nuanced topic and I appreciate it.
Yeah, thank you so much.
Yeah.